Hello, welcome to Talk Show. I am Petra Yudengchat.
And Amolapon Misu. Both of us were given the duty of MC. Today, we are going to talk about the COVID-19 because that is still good for Thailand. So, we invite special guests for today. Can you introduce yourself?
Hello, I'm Visita Thasa.
Hello, my name is Lungpelin Kotapat.
Hello, doctor. I want to know what is COVID-19.
COVID-19 is contact disease made from the most recent form of the coronavirus. This new virus and plague were not known at all before the outbreak in Wuhan, China, December 2019. Right now, COVID-19 is a major epidemic. It affects many countries around the world, and is so frightening.
What are the symptoms of COVID-19?
The common symptoms of the COVID-19 are the most common symptoms: no sneeze, no smell, no red smell, and fatigue. Some of the symptoms can be caused by headache, nose pain, sore throat, dizziness, skin loss, or skin tone. Some of them were infected, but they weren't severe. Most patients, 80%, get sick without having to go into the hospital. About 1 out of 5 of the cases of COVID-19. Elderly people, including high blood pressure, heart disease, diabetes, or cancer, tend to be more severe. However, anyone can get severe COVID-19 and potentially ill, all ages with fever and or cough, along with breath pain, chest pain, weight loss, or loss of the movement. Medical attention should be advisable if possible. To call ahead to the hospital can provide the suggestion.
What do you think we should do to live safely from COVID-19?
1. Maintain a safe distance from other, at least 1 meter, even if the person is not sick. 2. Wear a mask in public places, especially when in closed area or unable to keep distance. 3. Avoid closed area. Try to stay in an open ventilated area. Open window when in enclosed space.
4. Wash your hands often using soap and water or hand sanitizer with the main ingredient being alcohol. 5. Get vaccinated when eligible. Follow local guidelines regarding vaccination. 7. Cover the nose and mouth with the crook of the elbow or toilet paper when coughing or sneezing. 7. Stay home when you feel unwell. 8. Shouldn't be in a crowded place.
Currently, the vaccine prevents how many types of COVID-19 are there?
At present, there are 4 types. 1. Genetic vaccine, including mRNA. This group of vaccine is used a new technology to synthesize viral messenger RNA, mRNA. Genetic material. Vaccine carry mRNA to cells and direct the cells to produce viral spike protein. This protein stimulates the body immune system to produce antibody against the infections. Currently available vaccines include Pfizer and Moderna vaccine. Currently, this vaccine approximately 95% effective In preventing disease, preventing suffers. Illness and preventing 100% of death. 2 injections are administered intramuscularly 2 weeks apart. Moderna vaccine. 2 vaccines use virus vector. This vaccine uses genetically engineered viruses such as adenovirus, which are genetically modified so they can divide and curate the genetic material of the COVID-19 virus. When injected with the virus, they determine natural infection by stimulating the immune system to make antibody against the COVID-19 virus according to the genetic material. Insert, however, even if this vaccine in which the adenovirus does not divide, this is also classified a live virus when this entered the body. Therefore, this is not recommended for use in people with severe immune deficiencies.
Vaccine made from part of the protein of the virus. The crescent produced by this technology, the world has long been familiar with because it is used in the production of many vaccines, such as influenza vaccines, hepatitis B vaccine, etc. It's produced by producing virus protein by culture, yeast, baculovirus, etc. and then mixed with immune separate. 4. Inactivated vaccine. This group of vaccine is produced by taking the COVID-19 virus to raise a larger number of and used to cause the game to die. Vaccination stimulates the body to build immunity against all parts of the virus, as if directly infected with the virus, but not cause disease because the infection is dead. This technology is used from the hepatitis A vaccine, injectable polio. Therefore, they have been familiar with their effectiveness and safety for a long time. But because correcting the virus requires extreme caution, this made it slow and expensive to produce. The vaccine currently in use, the Sinovac vaccine, is 40 to 70% effective, prevents 100% of death.
So both of us will summarize the story about COVID-19 for you. Knowledge about coronavirus. Pandemic of COVID-19 is an ongoing global outbreak of the coronavirus disease. 2019 COVID-19 caused by the novel coronavirus. It started in December 2019 and was first discovered in Wuhan, the capital of Hubei province, China. In World Health Organization declared out the outbreak an international public health emergency on January 30, 2020, and declared an pandemic on March 11, 2020, May 26, 2021, Greenwich Mean Time 7:04 a.m. There are more than 168,535,137 confirmed cases in 220 countries and territories.
1. Pathogen. Coronavirus are single-stranded RNA virus. Family coronavirus. The infection has been reported since 1965. It can infect both humans and animals such as rats, chickens, cows, buffaloes, dogs, cats, rabbits, and pigs. Compare swallow. Subspecies and cause symptoms shown in the system, such as the respiratory system, including severe acute respiratory syndrome of SARS, gastrointestinal, nervous system, or other system. 2. Disease characteristics. Respiratory coronavirus infection may cause symptoms: fever, fatigue, headache, runny nose, sore throat. Cough may have the appearance of a lungs inflammation, pneumonia, or bronchitis. In other children may have symptoms of asthma. Severe acute respiratory syndrome will be found with fever, headache, fatigue, or flu-like symptoms, and then has a cough and get tired quickly, with the mortality rate higher in elderly parents or have a congenital disease. Coronavirus infection in the gastrointestinal tract. Gastrointestinal coronavirus are most common in children, newborns, and infants less than 1 year old, or may be found in immunocompromised adults. The infection can be found even in pregnant, asymptomatic, and non-definite disease season.
3. Incubation period. On average about 2 days, maybe 3 to 4 days. Incubation period for SARS may use an incubation period of 4 to 7 days, may be as long as 10-14 days. 4. Method of transmission of the disease: spreading the infection through contact with respiratory secretion, or spreading the infection from droplet, mucus, several droplet from infected patients by coughing or sneezing. 5. Protection. Exercise regularly and get enough rest. Should eat nutritious food and complete 5 food groups. Do not come in close contact with the patient. Advise the patient should to wear a mask. Cover your mouth and nose when coughing or sneezing. You should wash your hands often with soap and water, especially when exposed to secretion from patient before eating food and after execution. Avoid entering crowded areas or in public community with a large number of people in order to reduce risk of contracting the disease.
That is a shame for today. We would like to say goodbye. Thank you for watching. Bye bye.
Thank you. Bye bye.
Bye bye.
Bye bye.